Understanding patterns. Instead of diagnoses, health is often viewed through diagnoses such as migraines, anxiety, or high blood pressure. While these labels are essential for communication and treatment, they mainly describe what a condition is, not always why it occurs. Pattern recognition looks deeper, searching for the biological relationships that connect symptoms and reveal the processes driving health or disease. Different symptoms, shared pattern. Imagine two people visiting a clinic. One suffers from migraines, the other struggles with digestive problems. At first, they appear unrelated because they affect different parts of the body. Yet both may reflect the same underlying biological imbalance. Recognizing this possibility shifts our attention from isolated symptoms to the interconnected systems producing them. The limits of diagnoses. Diagnoses play a vital role in medicine. They guide treatments, support research, and help healthcare professionals communicate effectively. However, diagnoses are labels, not complete explanations. Two people with the same diagnosis may have very different underlying causes. Understanding these differences is essential for developing more personalized and effective approaches to health. The forest analogy. Imagine a forest where several trees look unhealthy. One has yellow leaves, another weak branches, and another grows slowly. Treating each symptom separately may help temporarily, but if the soil itself is depleted, improving the soil benefits every tree. Human health often works the same way with shared patterns beneath different symptoms. Symptoms are clues. Symptoms should not always be viewed as isolated problems. Instead, they often act as clues pointing toward deeper biological patterns. Learning to recognize these patterns helps explain why seemingly unrelated conditions frequently appear together. The goal is not simply to reduce symptoms, but to understand the processes producing them. Sleep as an example. Poor sleep rarely affects only sleep. It can influence mood, concentration, appetite, digestion, inflammation, and energy levels. Rather than treating each consequence independently, we can ask whether they represent different expressions of the same disrupted pattern. This systems perspective provides a more complete understanding of overall health. The body is interconnected. Modern research shows that biological systems constantly influence one another. Sleep affects hormones, hormones regulate metabolism, metabolism shapes energy, and energy influences behavior and mood. Mood then feeds back into sleep. Instead of separate systems operating independently, the body functions as an interconnected network where changes spread throughout the entire system. Why chronic conditions multiply? Many people accumulate diagnoses over time. Digestive discomfort becomes fatigue, then anxiety, sleep problems, and metabolic concerns. These conditions may seem unrelated, but they often reflect one ongoing biological story. Recognizing recurring patterns helps us understand how multiple symptoms can emerge from shared underlying processes rather than separate diseases. The orchestra analogy. Think of an orchestra performing out of sync. Individual instruments may sound imperfect, but the real issue is poor coordination across the entire ensemble. Similarly, health depends on interactions between body systems. When communication between those systems becomes disrupted, multiple symptoms emerge even when no single organ appears solely responsible. Systems thinking. A major shift in health science is moving from asking, "What disease does this person have?" to asking, "Which biological networks are functioning differently?" This systems thinking approach emphasizes interactions rather than isolated organs, helping researchers and clinicians better understand complex chronic conditions. Patterns, not diseases. Inflammation, blood sugar instability, chronic stress activation, and reduced recovery capacity are not diseases themselves. They are biological patterns. These patterns can contribute to many different diagnoses depending on how they affect each individual. Addressing the underlying pattern may improve multiple health problems at the same time. The traffic analogy. Imagine a city with severe traffic congestion. Deliveries slow, emergency vehicles are delayed, and businesses lose efficiency. Although many problems appear, they share one underlying cause: disrupted traffic flow. Likewise, when biological systems become inefficient, symptoms appear throughout the body as connected consequences rather than isolated events. Why improvements often come together? Many people notice that improving one aspect of health also improves others. Better sleep often leads to higher energy, improved mood, better digestion, sharper focus, and faster recovery. This happens because interconnected systems tend to improve together, reinforcing the idea that health operates through patterns rather than isolated symptoms. Not every symptom is equally important. Some symptoms provide more useful information than others. Like detectives examining evidence, healthcare professionals search for clues that reveal the underlying story. A headache may be the complaint, but poor sleep, chronic stress, or unstable blood sugar may offer greater insight into the biological processes driving the problem. Looking for relationships. Experienced practitioners often ask questions that seem unrelated to the main symptom. They explore timing, lifestyle, stress, sleep, recovery, environmental exposures, and daily habits. These questions help identify recurring relationships and patterns, allowing them to understand the entire system instead of focusing on one isolated complaint. Recognizing problems. Early weather forecasters monitor changing pressure, temperature, and wind long before storms arrive. Similarly, health patterns often shift before disease becomes obvious. Recovery slows, energy fluctuates, sleep worsens, and digestion changes. Recognizing these early signals provides an opportunity to intervene before more serious health problems develop. Why early patterns? Matter patterns are often easier to change than established diseases. Early recognition allows lifestyle changes, preventive care, and targeted interventions to restore healthier function before lasting damage occurs. Prevention becomes more effective when attention shifts from waiting for diagnoses to recognizing emerging biological changes. Diagnoses still matter, as pattern recognition does not replace medical diagnoses. Diagnoses remain essential for emergency care, treatment decisions, and scientific research. Instead, patterns complement diagnoses by helping explain why a condition developed and why two people with the same diagnosis may require different approaches to improve their health. One diagnosis, different causes. Consider high blood pressure. In one person, it may relate mainly to chronic stress. In another, poor sleep, metabolic dysfunction, or kidney disease may be more important. Although the diagnosis is identical, the underlying biological pattern differs, leading to different strategies for effective treatment. Personalized health. Personalized medicine recognizes that people express biological patterns differently. Rather than assuming every patient with the same diagnosis requires identical care, clinicians increasingly seek to understand the individual's unique network of contributing factors. This approach aims to improve outcomes by addressing the underlying mechanisms affecting each person. The future of medicine. Future healthcare may focus less on identifying diseases alone and more on recognizing emerging biological patterns. Patterns reveal relationships, indicate likely causes, and suggest opportunities for prevention. This perspective encourages earlier intervention and a deeper understanding of how the body's systems influence one another. Key takeaway. The body constantly communicates through interconnected signals rather than isolated symptoms. When we shift from viewing health as disconnected diagnoses to recognizing recurring patterns, seemingly unrelated problems begin to fit together. Understanding these relationships provides a clearer picture of health and opens the door to more personalized and effective care.